Welcome to Career View. This is the podcast where we ask questions you want to know when it comes to pursuing a career path. I'm your host, Niraj Shamal, and each episode I will ask questions on behalf of students across the country from secondary schools and universities what they want to know when it comes to pursuing their dream job. For today's episode, we'll be asking our top questions that have been submitted by students on our Career View website who are interested in a career path as a pharmacist. Joining me today is 26-year-old pharmacist Christian Portelli, who specialises in medicines and patient care. Christian has worked in many different environments, from hospitals all the way to community pharmacies, and he has a lot to share with us today. So, let's hear from him. All right, and we're back. Last episode of the year. Christian, how's the year been for you?
It's been exciting. Come off just graduating my bachelor's degree in pharmacy, so definitely very relieved. I'm moving into Carafa in a few days actually to work as a pharmacist up there in the rural community. So looking forward to that, but it's been a bit of a hectic year, especially being in the course of pharmacy. It's been very stressful, but been loving it.
Fantastic. And it must be a huge relief once again finishing your degree and moving to rural. Wow, that's going to be a real change in scenery for yourself.
Yeah, definitely. I think it's something that I've just wanted to challenge myself. I just want to put myself out there. Always been stimulated by new activities, something that I'm really passionate about, being in the rural healthcare. Yeah. I've done prac during my uni degree, where you go to different places and practice as a pharmacist. Yeah. So, and I found, rural was definitely something that I loved.
Fantastic. No, great to know, Christian. Exciting for 2023 what you have planned. Now, before we jump into our top questions asked by students, first thing I want to ask you is understand your journey and how you fell into the pathway of becoming a pharmacist. It feels like a very niche role, in my opinion, but was this something that you always considered as number one choice?
Actually, no. So when I was in high school, I loved my sport. So I was always interested in, becoming a physio. That was the main goal at that time because, loving sport, I was like, let's do a sport physio. That'd be amazing. Work for sporting teams. That was something that I was really passionate about at the time. Then I get into university. I did just over a year and a half and wasn't really enjoying what I was doing at the time. So I had to sit back a bit, just realign my goals at that point. And then I kind of just fell into pharmacy almost. I took a semester off. Looked at a few degrees. I knew I wanted to stay in the health science area. So, and then, pharmacy popped out when I was just looking through the course handbook. And I was like, well, this sounds really interesting, knowing how all the drugs work, how it works in your body. And then applying that knowledge to primary healthcare in the pharmacies looked really rewarding.
And once again, it comes back to a very common situation that we find with a lot of young professionals of different careers. It's a small minority of people that, hey, this is the first thing I want to do. It's actually the majority of actually finding different ways and definitely trying this and seeing that's not working and then coming back to, leading you down the pathway of what you're actually truly passionate about. So I find that, once again, really great to hear. Jumping into our top questions asked by students. The first question that we have for you is, how hard is it to become a pharmacist?
University, the actual degree itself, is definitely challenging. The workload coming from year 12 into first year becomes more independent. So you'll find that, you need to be on top of everything, can't be falling back behind. Otherwise, it's going to be hard to catch up. It is very content driven. There's a lot of new topics you're learning. So you need to just be making sure you're doing everything during the weeks leading up to your exams. As you go into second, third and fourth year, it becomes more specialised. So you start doing more what you're going to do as a pharmacist. So you're starting to learn all the different types of diseases, disorders, and then applying pharmacological knowledge and medicines that you need to help people with.
Yeah. And is there any point where the work becomes just overbearing and you just wow, this is a lot more than I expected?
Yeah, I feel like every semester potentially. Okay. Towards the end of the exams, it gets quite hectic. We're doing close to probably 9 hours a day of study.
Jeez. Coming
up to the study periods, just because there is quite a lot of knowledge or quite a lot of just content that they push into the units. So it is very intense, I would say, but best thing is to make some friends and just all study together, and that's the best way to just bounce ideas off each other. That's the best way to study in my opinion.
So everyone really does help each other. You got a good community in that.
So the cohort does start to get smaller as you progress through the course.
Okay.
Naturally, people fall off, people do other things. which is fine. So you do end up with quite a small, probably about 100 people in the cohort by your fourth year. So everyone knows you. You can always ask people for help, and everyone's pretty friendly.
Fantastic. That's great to know. Moving on to our next question that we have for you. What university did you select to study and why?
So I selected Curtin University to study Bachelor of Pharmacy with honours. Reason really, they don't offer Bachelor of Pharmacy at any other university. So Curtin only offers the Bachelor of Pharmacy and then a Masters of Pharmacy as a postgrad, and UWA only offers the Masters of Pharmacy. So that's pretty much the only reason more than anything. It wasn't because I had multiple choices to go to. It's just they don't offer that at other places. So that's pretty much it.
Fair enough. And did you look locally? Did you consider over east or overseas? Was that ever something that came into picture for yourself?
I didn't really look at going over east. I wasn't really in my plan at the time. I think I just wanted to stay locally. Just easy for myself at the time.
Fair enough. And good to know. And do you know if it's changed at all by any chance? Is there more universities that are offering pharmacy?
In Perth itself, no, unfortunately. But there is definitely a range of universities over east that you can definitely go do the bachelor's. So there is a conference that all pharmacy students go to every year, which you can elect to go to. And it has all like the Bachelor of Pharmacies or Master of Pharmacies from around Australia that come together for like a congress. So there's definitely a lot of choices. It is a little bit limited, I would say, in choice for WA.
For that event that you're talking about, is that something that students can access and be a part of?
Yeah, so they offer it every year. With COVID, it kind of stopped a little bit. So I was able to go to the Sydney Congress in 2019, just before COVID hit, luckily. So it runs over about a week and you get to go do activities with other pharmacy students from around Australia, and you just get health professionals, people from higher up in pharmacy to come talk to you. So yeah, it's just a good week just to pretty much develop your skills, talk to other people and just have fun, honestly. But it is definitely available to all the students.
Fantastic. And we'll provide the details for that, for our listeners out there who are interested, because these are opportunities where students need to be a part of, right? If you really want to understand that this is a career path for you, going to events, doing your research, speaking to the right people in that community means everything. Next question that we have for you, Christian, is what is the study workload like in university? And if you can kind of give us a bit of a breakdown in detail and how you manage that whole workload.
All right. So usually when we start in the semester, you start learning all the knowledge. So you want to be making notes pretty much every week or after each class at least. So I best found that I'll consolidate all my notes for the week and then I'll transfer it onto like tables or something easy to read on, especially with drug knowledge. You have a lot of medicines that you need to know, classes, what they do, interactions, adverse effects, where to apply them, when not to apply them. So having it written just in paper everywhere becomes very confusing very quickly. Each person has their own way of studying. I understand this. So I think the best way I found was, put it onto a table at the end of the week. So I have it there. And then when it came towards closer to the exams, about, I would say, usually 2 to 3 weeks out from the exam, you would start studying. So you'd get those sheets or however you're doing your notes, and then just start reading and reading. What I found was, well, for myself, I like to write. So I'll write everything and I'll continuously write it. And that's how I kind of just get into my head a bit. And then also using students. So especially with primary healthcare, which is, when you go to a pharmacy, you're asking for items over the counter to help with like conditions such as like skin conditions or like headache, pain relief. So then we'll pretty much just like role play more than anything. So we'll pretend like we're a patient coming in, and then what would you do in this case or this scenario? That becomes very handy towards the end of your degree when you start doing complex cases and you need to know how to decipher about 2 pages of content for an exam to see what disease they have and like how to diagnose it, and then what medicines to give and like a management plan.
Yeah, okay, no, that's good detailed right there. But just coming back to the question on the workload, we got this question a lot from our survey for students who are interested in this pathway. The reason why is because there is a perception around this degree and this career that there is a lot of study and you require a lot of hours of yourself towards committing to this kind of path. Is that quite true in that you do need to give a lot to yourself, and how much would you need to, let's say, compromise other things, whether it be social life, hobbies, this, that, the other? Is it a really full-time 100% commitment?
I found that it was easy for me a little bit to juggle everything, especially my social life. I was able to see my friends still able to go. Obviously, to an extent, like I had a rule that a couple of weeks before exams, I wouldn't try and like socialize too much just because, I want to just be focused. I don't want to be tired, especially after, if you're doing like a long day of study, the last thing you really want to be doing is going out. Sometimes you just want to relax, have your own time. I had my own little hobbies as well. So I like to dabble a bit in music as well. So I was always doing that on the side. It's hard to say. I do think that it can become quite stressful, and that's why I feel like sometimes the cohort does start to become a lot less as you progress through the degree, just because the workload is quite difficult, but not to scare you off. I feel like with any health-related things or any health-related courses, the workload is going to be very similar. So I wouldn't want that to scare anyone off. But but you're definitely able to juggle your like social life, your hobbies, and study at the same time quite efficiently.
Good to know, and that's the reality of it. And it's not to scare people off, and it's just to tell the truth. And I think it's important in any career profession, the study load and the workload and everything that comes with it, understanding what will you be facing. Because sometimes universities, no, not sometimes, all the time, university is going to paint a picture that it's a great degree, you get these opportunities, but understanding what you need to go through to get there is very important. So appreciate that honesty and that detail there. Moving on to our next question that we have for you, asked by students, is what does a normal day look like?
Okay, so usually if you're working in pharmacy, which I was in community pharmacy, whether you're opening or closing, so obviously you're helping out with, as a pharmacist, you've got to be, opening the store up, make sure everything's on, make sure everything's working, making sure that your team is where they should be, and then...
And when you say community pharmacy, you just mean like a local pharmacy?
Yeah, just like a local pharmacy where you, like, just down the road from you, just go in there. Usually, as a pharmacist, you're dealing with patient scripts, so people are handing in scripts from their GP. You're trying to make sure that those scripts are correct for the patient, especially if there's patients that long-term people, so people that you've developed a relationship with, which is very common in community pharmacy, especially with the older generation of people. And then, so in terms of the scripts, you're just making sure that everything's correct dose, because you're the last line for the patient when they're getting that script. So if anything's going to happen, can sometimes fall back onto you, so you need to be very cautious in what you're doing. We're always doing a lot of health checks as well, especially for people with like diabetes, for blood pressure, so the cardiovascular side, and especially weight loss as well, because I work in Pharmacy 777, so they have quite a big weight loss program that they've developed through their franchise, which is very, very useful, for people that are trying to lose weight. And then we're also consulting with doctors, so calling up doctors is pretty frequent. It's more just to, if anything's wrong with the script, we want to get it corrected. As a pharmacist, you're not allowed to adjust anything on the script. So you need to obviously get authorization through the doctor. So you're always contacting them. And then also you got your primary health care. So any of the over-the-counter products that you see when you go into the pharmacy that don't require their script. So the pain relief, skin disorders, or like gut disorders, we're here to help. Anything for baby, we're also here to help as well. And then you also got providing education to promote like health literacy. This is very important, especially in the place I'm going to for next year is in rural, remote communities. So health literacy isn't as high in main metropolitan cities. So that's because they probably haven't had the opportunity to learn about certain things. They don't know when to come in for certain conditions that require like immediate attention. So trying to make sure that their education is at a high standard, that's for us. So we offer a lot of programs to do, to help them out, which is good.
Excellent. Wow, there's so many different elements. There's so many different elements to the role that I wasn't aware of. Just to break down a little bit in all the different activities that you do, what time does your day start and what time do you finish? And what does that look like from Monday to Friday, or is that Monday to Sunday? Or what does that look like, just for our listeners to get a bit of an understanding of the day-to-days?
Yeah, so pharmacy runs Monday to Sunday, depending on where you work. So times do differ. Most pharmacies that I've worked in start at 7 o'clock, 8 o'clock in the morning, and then run anywhere till 6 p.m. at night to 10 p.m. Or you also have 24-hour pharmacies as well. So it just depends where you're working, would depend on your time schedule. Unfortunately, during COVID, it became quite tough for a lot of pharmacies. So a lot of pharmacists were doing 10 to 12-hour shifts, sometimes without breaks as well, which became a bit of an issue, more because you can't have a pharmacy open unless the pharmacist is there. Wow. So sometimes pharmacies would only have one pharmacist at the pharmacy, which made it very difficult. Yep. Especially when you've got patients coming in constantly, it becomes a bit hectic. But this has definitely improved since 2021. definitely coming into 2022 has definitely improved quite dramatically. But yeah, so it can be a little bit hectic, but there is, it's very rewarding. So
fair enough. And coming back to your schedule, what does your schedule look like? Is that, you said you're working your own out. I mean, you work as much as you want.
Yeah.
What does that look like for you?
So I'm doing, at the moment, I'll be doing about 10-hour shifts.
Okay.
So usually I come in at 7 o'clock, 8 o'clock in the morning. Just depends. Anywhere between 7 a.m. and 9 a.m. you'll rock up, and then you do 10 hours from then. Usually you have fixed shifts, so that's what your manager will give you. Yeah, no, it definitely ranges.
Yeah.
But we usually you try to aim for just a full working week. So 38 and a half hours to 40 hours. But this does can differ. It has differed for me for sure. We do sometimes in more, especially during COVID, it was a lot more intense. So we're doing way more hours.
Fair enough. And I can understand, obviously, anyone could during a time of COVID being crazy, to say the least. But good to know it's a bit more balanced now for yourself. Moving on to our next question that we have for you is, what is the most challenging aspect of the role?
So I think with pharmacy, each patient is different. So you have to tailor an approach specifically to their needs and wants, especially when some patients can unfortunately be a little bit difficult. So you need to be just slow with them a bit and just take your time. I feel like an example would be, I was in Carafa 2021 for a bit of a stint. So with there, you've got the rural Indigenous community. You're going to be very cautious in the way you approach yourself, especially with in terms of trying to get information out of them. So the way we got taught, or the way we started to develop, was to talk about ourselves a little bit. So because they want to know who you are, because if you start asking personal questions, they're not going to give you anything. So once you start, what we'd say, for example, is, the Eagles are doing well this week, try and just develop some rapport. They love their footy. So you're talking about footy, or you're talking about, I was in Craft for only a little bit. So I was like, the weather's been amazing here, quite hot though.
Yeah.
And you're just trying to just explain who you are a little bit, or just, I'm Christian, pharmacist, I'm here to help. This is what I'm going to be doing.
Yep.
Feel free to query me, question me. This is what I'm here for. So it can be in those sort of situations where you're dealing with people that come from different religious backgrounds, where it's you can't just be bombarding them with questions, because they're just not going to give you anything. And then that makes it very difficult for you, because then you're not going to be able to give the best health experience for them. And they'll walk out of the pharmacy being like, geez, I don't want to come back here, which is not what we want, because we want them to come back because, once you start new medications, which is definitely common in remote Indigenous communities, where they're starting new medications, a lot of them, unless you've given them the education whilst in pharmacy, they're not going to usually continue taking them, which is going to lead to poor health outcomes, which is what we want to avoid.
Do you have to be a social person to jump in this career? It seems like you do. You're dealing with people all the time.
I would definitely say there is definitely a social aspect that you need, because if you're quite reserved, then it's going to be very hard for you to approach patients, because sometimes people come to the pharmacy, they're just browsing around. So the ability to go up to someone and be like, is there anything I can help you with? You're here for anything that... Yeah. So there is definitely a social aspect, I would say. Doesn't mean that you need to be very outgoing, very extroverted. It's not what I'm saying at all, because there's a lot of people that are definitely introverted. I would consider myself a little bit more introverted than anything. So I think you definitely develop those skills. They set you up in the degree to become more, social and how to approach people. So they don't just throw you into the deep end when you get into the job. You've been practicing this for the last 4 years.
Fantastic. So good to know there's a lot of good support through the degree and through your network as well. Next question that we have for you, asked by students, is what other career options could you consider with your pharmacy degree / background?
Yep. Okay, so in terms of a pharmacist, you've got a different range. So community pharmacy, so that's what I do. That works in the community. So where you go down the road, you see a community pharmacist, your 777s, your AmCals, for example, the price lines. Then you've got hospital pharmacists. So they're on the clinical side. So they're dealing with inpatients that come in from emergency department that are going to be there either for a short stay or a long stay. There's definitely a much larger clinical side to that, where there's specialised drugs that you need to know and need to be on top of, and you're seeing those patients quite frequently, hopefully. And then you've also got rural community pharmacy, which is what I'm going to be doing next year, which is another aspect to I would say, just the metropolitan community. And you also got aged care pharmacists, so pharmacists that deal with going to aged care facilities with the older generation or people that are in those nursing homes. They're on multiple medications, which becomes very dangerous very quickly if they're not taking the right thing or their doctors didn't know they were on a certain medication that interacts with each other. In terms of other career options that you can go out on, you've got the very common thing that I see a lot of my colleagues do is sit their GAMSAT and then become a doctor. Most of the doctors that been a previous pharmacist that then become a doctor are probably the best of both worlds. So you have like that massive drug knowledge complementing with like the knowledge you get from medicine that you learn in your medicine degree. So that is definitely another side. That's something I would potentially consider. Not too sure when, but I want to just work as a pharmacist for a bit and then see where it takes me.
This is exactly what I wanted to get down to in terms of understanding what are the different options that you can consider with your degree and even medicine. You see how it can complement both worlds. So that's great to know that you have options.
Yeah,
I think
definitely.
That's the main thing. Next question that we have for you, and one of our most popular questions that we always get on our survey is, how much do you get paid? And how far can it go?
Okay. So for myself, when you're working, so when you're studying, you'll be a pharmacy assistant. So that ranges anywhere between $25 to $30. Once you graduate,
$25 to $30 an hour.
An hour, yes, an hour. So you get paid for what you work. So you're not on a fixed salary every year. So if you've worked 50 hours in a week, you'll get paid the 50 hours overtime as well. So then you go to intern pharmacist. They range anywhere between $25 to $35 depending where you work. So it's it varies everywhere.
Okay.
And then as a pharmacist, this is also dependent. So if you're in metropolitan community, about 40 to 45 an hour. And then going into hospital, they're more on a fixed salary, I would say, but they can range. That scales up quite quickly with hospital because you can be on quite a lot of money if you're doing that for a few years.
Right.
Only in the public sector, that is. Private sector is a bit harder because they're not government funded.
Fair enough. And when you say quite a lot of money, do you have any kind of understanding based on the fact that you're exposed to this industry?
Yeah, I see adverts out and, I've spoken to a few people, it could range anywhere from a starting salary of like 85 to 90 grand going up to quite high. If you're a senior pharmacist at, like, for example, at like a high-end hospital, public sector, that is, so that's government funded, could be on like 140,000 a year.
Yeah.
So
fair enough.
It does get high very quickly.
Very, very quickly. And once again, important for our listeners to know about pay and structure. And interesting enough, it's not, you start off with an hourly rate. I didn't know that. Like you would think that after you graduate, maybe you're working you get a fixed salary, but no, in most situations as a community pharmacist for yourself, it was an hourly rate. Yeah.
And I also forgot as well with like rural remote pharmacies, especially what I'm going to be going into, pharmacist wages can range anywhere from $60 plus per hour as well, because healthcare professionals are so sought for in those communities that they're willing to pay the extra bit. So,
great to know. Really good information and insights there from yourself, Christian. Last question that we have for you asked by students is, what are your long-term goals and ambitions with this career? Very personal question, but keen to get your insights here.
So I think next year I'm going to be going to Karratha to work as a rural pharmacist there. I think my long-term goals would be to at least try and enhance the health literacy in those rural communities. That's something I'm really passionate about at the moment. If the opportunity arises, potentially co-owning or owning my own pharmacy, the community pharmacy, whether that's in a rural area or back in Perth, WA. If I do have an opportunity as well, maybe move into hospital pharmacy. I was in South Bunbury Hospital earlier this year. I really loved it there. So that's something I hadn't done before. So it was really interesting to see, what a hospital pharmacist does. So that definitely flicked a switch in my head a bit.
Yeah.
So I think I might try and move into that a bit later on in the career. And then, like I said before, where you can go with your pharmacy degree, I might want to sit my GAMSAT. I think that's something I'd be definitely interested in, but I'm not too sure at this stage where that is going to fit in.
Yeah.
I'm really passionate about just being a pharmacist at the moment. So just want to do that, try and provide like all the healthcare I can. I love talking to patients on a daily basis as well. So and developing like rapport with them, which I found really rewarding.
Yeah, focus on the short term. Focus on what matters right now. And I like that, Christian. And to know that for yourself, you've got so many different pathways that you can consider, whether it be running your business or sitting the GAMS out or becoming a doctor. You have those options, which is once again comes back on the fact that this career and this pathway opens doors in many different ways. So very excited to see where you go in the future, mate. That wraps up all our questions that we have for you. Thank you so much for being here, mate.
Thank you for having me.
Yeah, now for our listeners who have more questions for Christian that did not feature on our list today and would like to connect with him, just visit our website, careerview.com.au. This is where you'll find Christian's profile and you can email him with some more questions, and I'm sure he'll be happy to answer when he has time and he's in Karratha. And with every episode, please don't forget to submit the questions you want to know, especially to young professionals who've been there and they've done that and they can share their stories. Before we let you go, Christian, I have one last thing that I wanted to ask you. And I found it really commendable, the fact that you were in a spot where you were not enjoying what you're doing with sports science, but you came out of it. My question is, what advice would you have for anyone who is in that similar situation where they may not be enjoying what they're doing and then trying to understand what they want to do and how they can do it?
Yeah, I think at the end of the day, there's no real wrong pathway in terms of where you want to go. As you start getting older, your ambitions and goals will definitely change. I found through Curtin University, they have a great support team in terms of the support councils with like the degrees. So you can go speak to any of the staff there and they can help realign with your career goals, what you're more interested in. And they'll kind of like tailor a few different different like courses that they think might be suited to you. If you're not enjoying it, I would say maybe try and write down what you don't enjoy about the course, and then sit back a bit and just be like, okay, maybe this is not for me. There's no stress there's no issue about going back off a course. People do it all the time. It's not a bad thing, because at the end of the day, like, this is going to be your career for the next 50 years at least. So like, you needed to know, like, do I love this or not? And if it's not really something you love, then sit back. There's a great support team, especially at Curtin University, that I fell to, and they'll help you realign your goals, and then they'll help you find a new course that, you know, you're going to be passionate about, which I found really useful.
Fantastic, Christian. Really great advice, and thanks again for being here.
Thank you.